Thank you, Madam Chair, and just thank you everyone who's been a part of this, the witnesses and your testimony today. I'm pleased that you are bringing this legislation forward today. Earlier, Representative Ruiz was talking about the teaching health centers and how important they are. I'm proud in Spokane to represent one of the teaching health centers that is making a big difference in our region. We are excited that Washington State University has built a medical school. The University of Washington and Gonzaga are partnering on a rural training track. I represent an area that has a lot of rural communities. And this effort in Spokane is definitely part of the solution. When I look at the partnership between the Teaching Health Center, the universities, the local hospitals, and then our local VA. We need more doctors. We need more doctors throughout Eastern Washington. And I'm also reminded that where the doctor does their residency, they're more likely to practice. I met a doctor not too long ago who had come from California to Spokane 30 years ago to do his residency, and he's still there. And it underscores how important it is, these residency programs. So I am a strong supporter of the Teaching Health Center Graduate Medical Education Program, the legislation that is before the committee today. You know, it's estimated that nationwide we'll have more than 23,000 shortage, we'll be short 23,000 doctors by 2025. And it's really unacceptable, and you see it further in the rural communities where the physician to patient ratio is especially stark. Only 10% of physicians practice in these areas, even though a quarter of the population lives there. Compared to doctors who train in the traditional Medicare program, those trained at teaching health centers are 60% more likely to practice primary care and 30% more likely to work in a rural or underserved community. I was proud to help lead this legislation in the last Congress where we doubled the funding, and I am excited and encouraged that we're continuing that effort in this Congress. Representative Ruiz, Torres Small, Representative Rowe, and I have joined in introducing HR 2815. And what it does is continue the support for this program by extending it for another 5 years and increasing the funding and providing more certainty, which we need across the country. This legislation and this program is important in meeting the needs of rural and underserved communities through a new generation of primary care medical professionals. The Teaching Health Center has programs that are meeting important needs in psychiatry, OBGYN, primary care, internal medicine, you know, the very fields that we need more of our doctors to be pursuing. So I have a few questions to Mr. Germano. I wanted to, in your testimony, you talked about the Shasta Community Health Center electing to become a teaching health center as a means of addressing the ongoing physician shortage. And I just wanted you to elaborate on that decision and just comment on how positively that may have impacted your effort to meet the needs in your community.
It is a big decision for a health center to be a sponsoring entity. You have to meet all the accrediting requirements. There's resources that go into it. In the beginning, it's tough because your best clinicians become your teachers, which means you take them out of the direct services and now you're teaching. So the investment is more medium to long term when you make that decision. But my job and my board's job is to look ahead and look at what's coming at us. And the shortage was very real then. It's even more so now. So the Teaching Health Center program is a huge investment in our future, in our current and into our future. And we're seeing the paybacks now.
Would you just address how your facility compares to other teaching health centers across the country? And then also, I'm afraid I'm going to run out of time, the importance of the 5-year reauthorization.
Well, each health center has their own sort of reality that the resources they have available to them. So we're all a little different in that respect. Some are urban, some are rural, some are frontier. You know, we're very rural, and hence I think we have a few more challenges we're starting to get our hands around. We're not having the same exact retention rates as some of the city programs, but we're getting there, so I'm really excited about that. And I'm sorry, the second question was?
Well, the importance of the 5-year reauthorization.
We commit 3 years to every class. They have to know when we're recruiting. I can't have a medical student say to me, are you going to be around in 2 years if this program's going away? That's not a great recruitment tool into our program. We need to know, we have to have certainty.
Right, a 2-year reauthorization for a 3-year program just
Doesn't make sense.
doesn't make
Thank you.
sense. Okay, I appreciate the chairwoman for allowing me to wave on today. Thank you.